Tech TV, experience educational television.
Hello and welcome to Tech News Update. No Business as Usual project organized breast health awareness. The event, which took place on Saturday, 31st October 2020 at NBU Hub, was to sensitize about 40 people between the ages of 18 and 35 of Asokore Mampong and beyond in addressing women health-related issues and to stimulate economic growth and developmental issues in the municipality. The event created a forum for participants to discuss pressing issues affecting women's health, especially breast cancer, and be educated on strategies for early detection, the appropriate diagnosis, and treatments available.
Legacy Hospital, close to SOS, and currently we are running a maternity unit. It's very new, and with all the equipment required, all the machines you need. We conduct surgeries there, any kind of surgery. We have doctors, specialized doctors from Pomfanoche who are working there. And with the ANC service, because it's new, we are doing a promo for pregnant women.
Tech TV News spoke to the nurse who was the facilitator of the program about the need for regular breast cancer screening and the stigma attached to breast health.
Okay, with breast cancer, it's just an abnormal growth in the breast tissues. Breast cancer is not necessarily dangerous depending on the stage and how frequent you do your screenings and the checkups. With every lady, you are supposed to do at least breast examination of yourself twice. Even if you can't do it, you have to report to the health facility for a midwife who is specialized in the reproductive system of a woman to do it for you, or a doctor. Okay, with the signs and symptoms, we all have lumps, a palpable lump in our breast, but if you do a frequent examination of yourself and you determine that there is an abnormal movable lump in your breast, you have to report to the facility. And we all have pores around our breast. You can't see them with your eyes, but if you begin to see those pores with your eyes, you have to report to the facility. Those could be signs of breast cancer. And if you have fluid oozing from your breast, you are not a breastfeeding mother, but you see fluid oozing from your breast. We have a clear fluid. If it's a clear fluid, we might term it as normal. But if the fluid is maybe brownish, greenish, or maybe bloody color, you should seek medical attention. And if you have a sore around your breast, maybe you are not breastfeeding. With breastfeeding, you experience sore nipple, but if you are not breastfeeding and you have a sore which doesn't go away, you should report. If you have skin rashes around the breast which doesn't go away too, it could be a sign that you have breast cancer. And if you have some scaly patches around your breast, it's very flaky. When you try to peel it, it wears off the skin. You have to suspect that could be breast cancer.
Tech TV, experience educational television.